You feel fine, completely normal. You go about your day, work, family, exercise, no symptoms, no pain, nothing. But inside your body, a silent assassin is working, damaging your arteries, straining your heart, setting you up for a stroke or heart attack, and you have no idea. This is high blood pressure, the silent killer. And nearly half of all American adults have it. Most don't even know. In this video, I'm going to explain exactly what high blood pressure is, why it's so dangerous, how to know if you have it, and most importantly, what you can do about it. Because here's the thing, high blood pressure kills, but it's also one of the most preventable and treatable conditions we have. Let's dive in. First, let's understand what blood pressure actually is. Blood pressure is the force of blood pushing against the walls of your arteries as your heart pumps blood through your body. Think of your circulatory system like a garden hose. When water flows through the hose, it creates pressure against the inside walls. Your arteries work the same way. Every time your heart beats, it creates a surge of pressure. Between beats, the pressure drops but doesn't go to zero. There's always some baseline pressure. That's why blood pressure is measured with two numbers. The top number, systolic pressure, measures the pressure when your heart beats and pushes blood out. The bottom number, diastolic pressure, measures the pressure when your heart rests between beats. A normal blood pressure reading is less than 120 over 80. We write it as 120 over 80 and say 120 over 80. But here's where it gets serious. High blood pressure or hypertension is when those numbers are consistently elevated. According to current guidelines, normal is less than 120 over 80. Elevated is 120 to 129 systolic and less than 80 diastolic. Stage 1 hypertension is 130 to 139 systolic or 80 to 89 diastolic. Stage 2 hypertension is 140 or higher systolic or 90 or higher diastolic. Hypertensive crisis is over 180 systolic or over 120 diastolic. This is a medical emergency. Now you might be thinking, what's the big deal? So my numbers are a little high, I feel fine, and that's exactly the problem. High blood pressure has no symptoms, none. That's why it's called the silent killer. You can have dangerously high blood pressure for years and feel completely normal. Meanwhile, it's silently destroying your body. Let me explain what high blood pressure does to you. Your arteries are like flexible tubes. Healthy arteries expand and contract with each heartbeat, absorbing the pressure surge. But when pressure is consistently high, your arteries are constantly under stress. Imagine taking a rubber band and stretching it over and over. Eventually, it loses elasticity. It becomes stiff and brittle. That's what happens to your arteries. They become stiff and narrow. This is called atherosclerosis. The high pressure also damages the delicate inner lining of your arteries. These tiny injuries become sites where cholesterol and other substances can stick. Plaque builds up. Arteries get even narrower. This creates a vicious cycle. Narrower arteries mean higher pressure. Higher pressure means more damage. More damage means narrower arteries. And that's when the serious complications start. Heart attack. When the coronary arteries that supply your heart get blocked, part of your heart muscle dies. High blood pressure is the #1 risk factor for heart attacks. Stroke. When arteries in your brain get blocked or rupture, brain tissue dies. High blood pressure causes about half of all strokes. Heart failure. Your heart has to work harder and harder to pump blood against high pressure. Over time, the heart muscle thickens and weakens. Eventually, it can't pump effectively anymore. Kidney damage. Your kidneys are full of tiny blood vessels that filter waste. High pressure damages these vessels. Over time, your kidneys fail. High blood pressure is a leading cause of kidney failure. Vision loss. High pressure damages the delicate blood vessels in your retina. This can lead to bleeding, swelling, and eventually blindness. Aneurysm. Constant high pressure can cause weak spots in artery walls to bulge out like a balloon. If an aneurysm bursts, it's often fatal. Cognitive decline and dementia. Damaged blood vessels in the brain affect memory and thinking. The scary part? All of this damage happens silently. You don't feel your arteries hardening. You don't feel plaque building up. You don't know your kidneys are failing until they're nearly gone. That's why regular blood pressure checks are so important. Now let's talk about what causes high blood pressure. For about 95% of people with high blood pressure, there's no single identifiable cause. This is called primary or essential hypertension. It develops gradually over years due to a combination of factors. Age. Blood pressure tends to rise as you get older. Arteries become stiffer naturally with age. Genetics. High blood pressure runs in families. If your parents had it, you're at higher risk. Race. It's more common and more severe in African Americans. Obesity. Extra weight requires more blood to supply oxygen and nutrients to tissues. More blood volume means more pressure on artery walls. Lack of physical activity. Inactive people tend to have higher heart rates. The higher your heart rate, the harder your heart works with each beat, and the stronger the force on your arteries. Too much salt. High sodium causes your body to retain fluid, which increases blood pressure. Too little potassium. Potassium helps balance sodium. Without enough potassium, sodium builds up. Alcohol. Drinking too much can raise blood pressure. Stress. Chronic stress may contribute to high blood pressure. Smoking. Tobacco damages artery walls and narrows arteries. For the other 5%, high blood pressure is caused by an underlying condition. This is called secondary hypertension. Kidney disease, sleep apnea, thyroid problems, certain medications, especially decongestants and birth control pills, illegal drugs like cocaine. Treating the underlying condition often fixes the blood pressure. Now here's the critical question. How do you know if you have high blood pressure? You get it checked. That's the only way. Blood pressure screening should be part of routine doctor visits. Everyone over 18 should have their blood pressure checked at least every 2 years if it's normal. More often if it's elevated or if you have risk factors. You can also check it yourself. Home blood pressure monitors are inexpensive and available at any pharmacy. If you're checking at home, follow these guidelines. Sit quietly for 5 minutes before measuring. Don't talk. Sit with your back supported, feet flat on the floor, arm at heart level. Take 2 or 3 readings, 1 minute apart. Average them. Measure at the same time each day, preferably in the morning before medications. Keep a log. Bring it to your doctor. One high reading doesn't mean you have hypertension. Blood pressure fluctuates throughout the day. That's normal. Hypertension is diagnosed when blood pressure is consistently elevated over multiple measurements on different days. If your blood pressure is high, your doctor will likely recommend lifestyle changes first. If that doesn't work, or if your blood pressure is very high, prescribe medication. Let's talk about lifestyle changes, because for many people, these alone can bring blood pressure down to normal. Lose weight. Even losing 5 to 10 pounds can lower blood pressure. Weight loss is one of the most effective interventions. Exercise regularly. Aim for 150 minutes per week of moderate aerobic activity. Walking, swimming, biking. Exercise strengthens your heart so it doesn't have to work as hard. Eat a healthy diet. The DASH diet, Dietary Approaches to Stop Hypertension, is specifically designed to lower blood pressure. Focus on fruits, vegetables, whole grains, lean protein, low-fat dairy. Limit saturated fat and cholesterol. Reduce sodium. Aim for less than 2,300 milligrams per day. Ideally, 1,500 milligrams. Read labels. Most sodium comes from processed and restaurant foods. Increase potassium. Eat bananas, sweet potatoes, spinach, beans. Potassium helps counteract sodium's effects. Limit alcohol. No more than 2 drinks a day for men, 1 for women. Don't smoke. Smoking raises blood pressure and damages arteries. Quitting is one of the best things you can do for your heart. Manage stress. Chronic stress contributes to high blood pressure. Find healthy ways to cope. Exercise, meditation, deep breathing, hobbies. Get enough sleep. Aim for 7 to 9 hours. Poor sleep is linked to high blood pressure. These aren't just suggestions, they're proven interventions. Studies show that intensive lifestyle changes can lower systolic blood pressure by 10 to 20 points. For some people, that's enough to avoid medication entirely. But if lifestyle changes aren't enough, medication is highly effective. There are many types of blood pressure medications. Diuretics, or water pills, help your kidneys remove sodium and water, reducing blood volume. ACE inhibitors relax blood vessels. ARBs, angiotensin receptor blockers, also relax blood vessels. Calcium channel blockers prevent calcium from entering heart and artery cells, relaxing vessels. Beta blockers reduce heart rate and the heart's workload. Your doctor will choose the right medication based on your specific situation. Often, a combination works best. The key is taking medication consistently, even when you feel fine. Remember, high blood pressure has no symptoms. You can't feel whether your medication is working, but it is. Let me tell you why treating high blood pressure matters so much. When blood pressure is controlled, your risk of heart attack drops by 20 to 25%. Your risk of stroke drops by 35 to 40%. Your risk of heart failure drops by 50%. Those are massive reductions. Controlling blood pressure saves lives, it prevents disability, it keeps you healthy and independent. But it only works if you actually do it. And here's the problem. Only about half of people with high blood pressure have it under control. Why? Because they don't know they have it. Or they know but don't take it seriously because they feel fine. Or they start medication but stop because of side effects or cost. Don't be that person. If you have high blood pressure, treat it. If you don't know your blood pressure, check it. Let's recap. High blood pressure is when the force of blood against artery walls is consistently too high. 130s over 80 or above. It has no symptoms. You can feel completely fine while it silently damages your heart, brain, kidneys, and arteries. It causes heart attacks, strokes, heart failure, kidney failure, vision loss, and dementia. Nearly half of all adults have it. Most don't know. The only way to know is to check your blood pressure regularly. It's preventable and treatable through lifestyle changes and medication. Controlling blood pressure dramatically reduces your risk of serious complications. So please, get your blood pressure checked. If it's high, take it seriously. Make the changes, take the medication. Your future self will thank you. If you found this video helpful, like and subscribe. Share it with your family and friends. This is information everyone needs to know. Comment below. Do you know your blood pressure? When's the last time you had it checked? Let's encourage each other. Thank you for watching. Your health is in your hands. Protect it.